So thank you so much for this kind invitation. So I'm going to talk about a study that we started a year ago, and it actually stems from the DiaUnion project that was established in 2020, and with the goal to have early detection programs for type 1 diabetes and related autoimmune diseases in the Eurozone area, which is between Denmark and south of Sweden and Skåne, as you can see on the map. And this area is about 4.3 million inhabitants, with Greater Copenhagen included. And with the dark green is the Skåne area where I come from, the county of Skåne, which has about 1.2 million inhabitants. But the long-term goal, of course, is to prevent and cure type 1 diabetes as well as other autoimmune diseases. So with this being said, I will move on. And this is not my recent slide, unfortunately. But the screening for type 1 diabetes and celiac disease and autoimmune thyroiditis in the general population was the goal for thyroid disease for the trial study. And the rationale for doing this and doing screening in the population, as been said before, is to detect the children in an early phase and to prevent acute and long-term complications. And also, a second goal is to identify healthy individuals at increased risk for the disease in future for inclusion, prevention, and intervention studies. So in order to do this in the triad study, we will use the radio binding assay method, which is a gold standard, as been discussed previously today. For screening of autoantibodies, we screen for the type 1 diabetes-related autoantibodies and celiac disease autoantibodies, and the thyroid autoantibodies, TPO and TTA as well. And the second step is to evaluate the new antibody detection by agglutination PCR ADAPT method for future potential screening. So the aims of the triad was to explore the prevalence of autoantibodies for type 1 diabetes, celiac disease, and autoimmune thyroiditis in the general pediatric population. And the second aim was to test the feasibility of home capillary blood sampling for future large-scale screenings. So you must remember that this was, when we started the screening, was right in the second wave of COVID-19 pandemic in Sweden. And when we started to recruit the study participants, so this was quite timely at the time point to use home sampling testing. So when we started the enrollment in August 2021, that was when the third wave hit south of Sweden. So the goal of this first study, the feasibility study, was to obtain 2,000 samples from invited 20,000 children. We chose randomly selected from 33 different counties in Skåne to invite children aged 6 to 9 years of age, born 2013 and 2014, and ages 13 to 16 years of age, born 2006 and 2007. So the capillary blood sampling testing was taken at home, and they were sent to our laboratory for analysis. And those who had persistent or a positive test were asked for a confirmatory sample, and if they were persistently autoantibody positive, they were referred to a pediatrician for follow-up. So these were the results of the study population. Overall, we had 19,594 children that were randomly selected, invited. 18% accepted participation and gave consent. And successful home sampling testing was done in 2,350 children. And finally, we had 2,273 children included without prior diagnosis. Of those 240 children, 10.6% that were positive for any of the autoantibodies, 235 were confirmed positive, and 208 were persistently autoantibody positive, referred to the pediatrician. And this is a distribution by disease autoantibody type. And as you can see on the green bar chart or pie chart, we found that 3.3% were positive for any of the type 1 diabetes-related autoantibodies. 2.9% were positive for tissue transglutaminase IgA or IgG, and 4.8% were positive for autoantibodies, thyroiditis. Sorry, and this is by gender and age of those antibody-positive children. And as expected, more females were positive as compared to the boys. And also you can see the distribution by age. And here you can see that many of the thyroid autoantibodies are found in the teenage female population as compared to the boys. We also collected information about if any of the study participants had any first-degree relatives with any of the diseases. As expected, those that were autoantibody negative were had less first-degree relatives with any of the diseases as compared to those who were autoantibody positive. But the interesting thing that we found was that those that had any of the type 1 diabetes autoantibodies, many of them also had a first-degree relative with thyroid disease or celiac disease, which was also seen for the other autoantibodies as well. So the overlap of the three diseases is less than expected. In this population, of those 240 children that were positive, we found an overall overlap was 0.4% that were positive for any of the three diseases. And here you can see the clinical diagnosis after screening, and it is still pending because some of them are now waiting, 15 are waiting for endoscopies. But you can see that 3 have been diagnosed with type 1 diabetes, only 3 with autoimmune thyroiditis, and we have 18 with diagnosed with celiac disease, either being confirmed by biopsy or with very high levels of TGA. So a second goal is also to screen the Danish first-degree relatives of type 1 diabetes children from the Danish site. And this is the first preliminary results where we have screened almost 1,349 children now, and we use this at this time. We used this is an add-up results, and as you can see, there are an over number of positives with a Venn diagram quite busy. So 19.2% of being positive for any of the autoantibodies, and looking to the right table with the Swedish participants, you can see with the add-up method, it's a little bit higher number of autoantibody positives for each of the autoantibodies when we use the add-up method. So in conclusion, previously unknown autoimmunity for type 1 diabetes, celiac disease, or autoimmune thyroiditis is common in the Swedish children, particularly among the girls and children having a first-degree relative with any of the diseases. Home capillary blood sampling is feasible, and it's a safe procedure to obtain blood samples from the children. And we also see overall high prevalence of autoimmunity in Danish FDRs of children with type 1 diabetes. So what are the next step? Well, the next step is for the next screening, we will plan for the next year is to invite 20,000 children again, but this time we will switch and we will use the ADAP as the first-line screening test to pick up the autoantibody positive children, and we will confirm those with autoantibodies with the radiobinding assay. And thank you so much for attention. And absolutely, I would like to thank Alexander Lind and Maria Scherman, who's here today, who really performed the study. Thank you so much, everyone.